This segment is sponsored by Children's Hospital of Richmond at VCU.
It certainly can be scary to think about surgery, especially when it comes to your child. With Children's Hospital at VCU, surgeons are fellowship trained to meet the unique surgical needs of kids from infant to teen and every age in between. Just last month, Children's Hospital of Richmond at VCU earned national verification as a level 1 children's surgery center from the American College of Surgeons. Dr. Patty Lange, who joins us today, is a pediatric surgeon with the Children's Hospital of Richmond at VCU. She's joined by her patient, the lovely Millie Walmer, and her parents, Rebecca and Spencer. It is wonderful to see everybody. Thank you so much for making time for us today.
Thanks for having us.
Thank you for having us.
Absolutely our pleasure. Millie, I'm so happy to see you. We're going to talk with your family in just a few minutes. But first, Dr. Lange, I have a question for you.
Sure.
As we learn more, what is unique about pediatric surgery as compared to surgery for adults?
Well, the medical needs that kids face are often quite different from those of adults. And in our pediatric surgery world, our saying is that children are not just little adults. They have to be treated very differently. So whether it's surgery to address congenital malformations like Millie has, or bread and butter surgeries like hernia repairs or a number of other conditions, we have to always consider that their bodies are still growing and developing. And so it really takes an entire team that specializes in the care of children to assure their health and safety. And of course, operating on a tiny baby is very different than operating on an adult. So surgeons that deal with children have to go through specialized training to make sure they have the knowledge and expertise to do this successfully. And we also pride ourselves in working closely with parents and guardians to address concerns that they have to really provide comprehensive care before, during, and after surgery to fully address the child as well as the family's unique surgical needs.
It makes sense. And you've really given us a great overview of how that comes together. Children aren't little adults, so there are specialized needs certainly there. Dr. Lange, another question for you. What does it mean to be a level 1 children's surgery center?
So the American College of Surgeons is our big surgery component, and they set out a mission for obtaining children's surgery verification to improve the quality of children's surgical care by creating not only a system that allows for a prospective match of every child's individual surgical needs, but having the care environment that's optimal to have those resources. So in other words, we really want to have the providers as well as the resources to provide the safest and highest quality of care for all children undergoing procedures. And being a level 1 center also allows us to really collaborate with other centers that are also level 1 so that we can pool resources and pool data and continue with quality improvement projects to make sure we have the right care. And we're very honored to receive this recognition because we're one of only 30 children's hospitals in the entire country to have a level 1 verification. And it really takes a dedicated and skilled team to pull this together, including surgeons, anesthesiologists, nurses, administrative support, and data collectors to really ensure that we have the best care for all children. And we're really so excited to have this, not only for the notoriety, but also so we can help take care of kids as adorable as Millie.
Absolutely. And Millie's front and center now. Mom and Dad have really gotten her super engaged. So let's talk with them right now. Walmer Family, can you talk to me a little bit about the surgery that Millie's going to have and what your experience has been like working with the team at Children's Hospital of Richmond at VCU?
Yeah. So Amelia has what's called an omphalocele. So when she was in utero, her abdominal wall didn't form correctly. And so most of her digestive tract actually was in a little sac outside of her body when she was born. And the surgery is going to be, pushing the organs kind of into the abdominal cavity and then pulling the abdominal muscles around them. So it's like a massive hernia surgery.
We actually had the experience to consult before she was even born with some great doctors and nurses and staff. And they were all very positive about the prognosis. They were all very supportive and sympathetic and very, very loving which we were really grateful for. Dr. Lange was actually present when she was born in the operating room because she had to be born via C-section. And she's been with her every step of the way and more than just what she wants to do with repairing her omphalocele, but also with her overall care.
Yeah, we've just been like amazed at the level of care we've gotten at VCU. They've really, not been just interested in like her surgery, but also like her as a baby, her development, and just all of her health. Like Rebecca said, I mean, Dr. Lange and everybody at Shore has just gone above and beyond for us, and we're just so grateful.
We love VCU.
And it really is incredible. An experience like that is unique, but with Children's Hospital of Richmond at VCU, this is a common experience in terms of developing these kind of relationships. Thank you for sharing your experience, Walmer family. We really appreciate it. Dr. Lange, I have one last question for you. That verification and receiving that level of recognition is really important. What does that mean for other families here in Central Virginia?
So what it really means is that any child coming to us for any procedure, again, whether it's considered simple and routine, like a hernia surgery, or something really complex like trauma or cancer surgery, it's really a big deal for us and for the families. And we are very prepared, from providers to resources, to provide the best care for all children. And we're already verified for other programs such as trauma, adolescent bariatric surgery, and burn care. And so this just complements all the fields that we can offer, all the great care that we can offer kids. And the verification really is just an acknowledgement that we're providing expert care for kids of all ages, and that the families can get the care right here in Virginia, and that their children don't have to leave to go to another hospital to get the safest and the highest quality of care.
It makes all the difference. And as you were talking, Dr. Lange, I was waving at Sweet Millie. She is just incredible. Walmer family, thank you so much for sharing your story. And Dr. Lange, we really appreciate you making time and bringing us up to speed on what this means here in Central Virginia.
Thank you, Jessica.
Absolutely. Thank you so much.
Absolutely, our pleasure. We'll share more information so friends watching today can learn more.
The Children's Hospital of Richmond at VCU, you can contact them. 804-828-CHOR. You can also visit them online at chrichmond.com. We'll share our final thoughts and wrap up today's show in about 3 minutes.